We're now moving into our panel discussion. We have some additional panellists in the room, but we also have some panellists online. So firstly, introduce Jessica Szwarcbord, and I hope I've pronounced your name correctly, Jessica. Jessica is a Senior Policy Advisor with the Lowitja Institute. Jessica is passionate about working in the Aboriginal community-controlled sector, has previously worked in the health, mental health and family violence sectors in policy, project management and program design. She's currently leading Lowitja Institute's policy work on climate and health. She has an academic background in law, philosophy and screenwriting, and takes a multidisciplinary approach and enjoys combining theoretical frameworks and research with meaningful engagement to solve real-world problems and to develop effective, inclusive policies and strategies to improve people's lives. Jessica lives and works on the lands of the Wurundjeri people of the Koorliny Nation. Welcome, Jessica.
Thank you. Hi, everyone.
We also have Dr. Teah Carlson at Massey University in New Zealand online. And Teah has shared that she often thinks about her accountability to Papa. I'm going to not do this justice. I'm really apologise in advance, Teah. Papa Tanoku, Mother Earth, in every research approach, strategy, leadership practice and action that she does. She's committed to practices and processes that take into account our impact on Te Taio environment, Kaiora, Te Wanao, Kaora, Te Tangata. She's an artist, story catcher and teller. She's community psychology trained and she practices as a kaupapa Maori researcher and evaluator at the Te Wariki Research Centre at Massey University. Teah has shared that her work focuses on expressions, connections and articulation of mana wahine spirit, aroa and wisdom. We're really thrilled to have you join us this morning. Welcome. Now I'd like to invite our in-person panel guests. Hopefully you're sitting somewhere in the auditorium. Dr. Sophie Moustaka, who's a public health registrar with the Kimberley Aboriginal Medical Services. Dr. Sophie is a public health registrar working at Kimberley Aboriginal Medical Services, as I said. Her role includes working with the Aboriginal Health Council of Western Australia to co-design climate health adaptation planning initiatives for Aboriginal communities. This project supports Aboriginal stewardship and locally informed and led initiatives to address climate health risks. So welcome. And our final panel member is Dr. Donna, who's a public health physician with WA Health. Donna is a public health physician at WA Health's Communicable Disease Control Directorate. She's the domain chair of the Population and Preventive Health Domain School of Medicine at the University of Notre Dame, and she is a clinician at the M Clinic, a peer-led sexual health clinic for men who have sex with men. Prior to these positions, she was a GP and public health physician in the Kimberley for 11 years. And Donna, you might not remember me, but I remember you from the Kimberley, from Derby, because I grew up in Derby. Really lovely to have you all here with us this morning. So we'll start with you, Donna. As a healthcare professional, public health physician, can you share with us some of the impacts that climate change is already having or will have on our health and how we deliver healthcare? And can you also, share with us your thinking around how we should be really approaching and training the next generation of graduate doctors and healthcare professionals to be prepared for this?
Climate change harms health in all populations, and although I'm a doctor and I think of human populations, but as we've heard today, we actually have to think of animal populations and plant populations as well, because without them, we can't exist. So I think heat is probably one of the foremost things that we need to think about. That's increasing worldwide and that affects people's health. It also affects people's delivery of healthcare and delivery of a whole range of infrastructure services. Will it become impossible to work outdoors for large parts of the year? And if so, what impact does that have on on everyone. The other thing that I think we've seen a lot of is extreme weather events. They are becoming more and more frequent and more extreme. And so that has immediate effects in terms of injury. It also causes illness. It affects our ability to grow food. And as climates change, then infectious disease patterns change, because bacteria, viruses, and vectors of these things will move into areas that they previously hadn't been able to live in. The extreme weather events also cause major loss of physical assets and damage to key infrastructure that we all require for our health and well-being, and just for society to function. And so the place where I would consider I grew up as a doctor, the Wamajiri, the Bunaba, and the Gunyandi people who really helped me to grow up as a doctor, they were affected very severely by the flooding of the Fitzroy River in the Fitzroy Valley. And I was there just recently, and there's the kind of really obvious stuff that you think about of how it affects health. Then there are things that are far more ongoing and long-term. And one of the stories that was shared to me by one of my friends was that in Danjoo, Giki Gorge, there's a large white rock. And this is a rock that I knew well because, I spent a lot of time in that river. And she told me, that rock has shifted, Donna. And this is a really large white rock. There is a Aboriginal dreaming story that's associated with it. And then there used to be a small rock in front of it, and that small rock is gone. And she said, what do you think that effect is having on people when such a significant part of the landscape has shifted? And it really made me think, in a way that I hadn't thought before, about what are the long-term effects of these extreme weather events. We think of flooding, you can think of it from a biological, point of view of, yes, houses are full of mold, people can't live in them. But when a major spiritual landmark changes in your life. So I thought I just wanted to share that with you. But then I thought, well, we can't be always thinking about gloom and doom. That's not the purpose of forums like this. And one of the really lovely things that I saw was that in the reconstruction of the bridge, which is happening at the rate of knots, when I got there, there were 3 pylons up for the new bridge. And when I left 2 weeks later, there were 7 pylons up. Many of the people who are involved in that reconstruction are local Aboriginal people and young people. And, I had some lovely conversations with people who are working in that space. So I think, where bad things happen, there is also opportunity and for people to grow and take up that space and be part of that healing journey. So I think now we might move on to sort of educating the next generation in a few minutes. This really causes, I think, a lot of conflict in doctors, because I was thinking about the World Medical Assembly's Physicians' Pledge, which we all take as a doctor. This was established in Geneva in 1948, and most recently it was revised in 2017. So I'll read out the first 3 lines. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. How do we reconcile those 2 things when, if the only thing I think about as a doctor is the health of the person in front of me, but in doing that, if that is causing harm to the rest of the planet, which then might hurt other people or animals or plants, how do we reconcile that? I don't have an answer for that, but I think it is something that future generations of doctors need to embrace. And as the current generation of doctors, I need to step aside and to let them into that space to give some of that new thinking. I think the other thing that future health professionals need to be able to do is to, as part of their medical training, not be totally clinically focused on the patient, but learn how to have conversations with other sectors of the community and other people in power and influence about how climate change affects the health of everyone and everything on the planet. And so that they can use that very privileged role of the medical profession to advocate and to work collaboratively with other sectors of society to make things better. So I think I might stop there. I'm sure I've used more than my allocated 4 minutes.
Thank you, Donna. We might go online now to Dr. Carlson. Could we just ask you to share, I'll respond to this question rather, is embedding cultural knowledge, environmental stewardship, equity, environmental sustainability, all terms that have been used across the last day and a bit at today's conference, enough of a goal or standard for greening our health system?
Tēnā rā koutou katoa. He uri mokapuna tēnei no te whānau apanui, Ngāti Porou, a Waikato Tainui Huki. I'm zooming in from the east coast of the North Island, and I just want to say it's a privilege to be here in your conference, and particularly to be invited for your movement, if you like, greening the healthcare system. This particular question strikes me because in the spaces that I'm working as a community psychologist, as a Māori researcher that privileges Māori community voice, power, agency, across the board, the terms of and praxis of sustainability, of equity, do not capture the Indigenous voice and power in which that influence can have in greening our healthcare system and addressing for the likes of climate change. So it's really around even extending our thinking beyond these paradigms of climate change, climate, all those kind of terms that we're using. If we're not using our own Indigenous terms and ways of being, then we're siloing again, we're gatekeeping again this Indigenous wisdom and knowledge and power and influence that you've all been talking about this morning. And very much I feel like I'm preaching to the converted, but it's very much an example of, I guess, where we're moving in New Zealand and Aotearoa around the fact that through our experiences through COVID, through flooding, through climate events, it comes back to the heart of the people. The community knows best. Māori people know best about the ways in which they want to address health and well-being. They know what's needed. You actually just need resource to directly go to them, and then they determine the pathways in which to address the impact or need, which is a shift for many Pākehā, many non-Māori. But for me, if it's not, it doesn't have also a racism strategy addressing climate change approaches or anti-racism strategies, then you're missing the point as well. So I guess my overall banner is what's good for Māori is good for everyone, which is good for Indigenous people is good for everyone. And if you don't have Indigenous voice, representation, power in every facet of the system, then you're doing a disservice to the broader population. So that's really at the heart of it. And I'll just kind of come to, I guess, the insight of which was opened around song, and draw on, I guess, our knowledge around a chant, or I'm trying to translate in my mind to not use Māori words. This is very difficult. A incantation if you like, and it goes, whakarongo, 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 whakarongo ki te tangiata manu e karanga re, tui, 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 tuia, tuia ki runga, tuia ki raro, tuia ki roto, tuia ki waho, tuia I te here tangata ka rongo te pō, ka rongo te pō. Tui I te here tangata e heke mai, I Hawaii ki nui, I Hawaii ki rua, I Hawaii ki pāmama, e hono ki te wairua ki te whaiau ki te ao marama. So that incantation is very much about everything you have spoken about. We have our own ways of being and knowing to flourish in this world, aligned with Mother Earth, aligned with Sky Father. And if you would only listen, that line of whakarongo is listen, and it's not listening with your ears, it's listening with your mind's eye, your heart, and your poku. And when those things align, sovereignty, emancipation, I want to like emancipate yourself from mental slavery. None but ourselves can free our minds. You know, Bob Marley said it very well. So I'll just close with that. Mauri ora, thank you very much for your time.
Thank you so much. We're now going to ask Dr. Moustaka or Sophie a question. So we've seen two presentations this morning, one from the Northern Territory and one here in Perth on Noongar Budja. We heard that when we acknowledge local and cultural contexts in developing solutions, and we've just had that reinforced from a Maori context as well, that we get really excellent results. Can you share with us how the Kimberley Aboriginal Medical Service is working with local community on climate change and on health around climate change more broadly?
Thank you very much. And thank you to everyone who's already spoken and shared your wisdom. I really appreciate it. So I'm working as part of a much larger project than one person in a chair, and it's led by the Aboriginal Health Council of Western Australia and partners 3 regional archers, Kimberley Aboriginal Medical Services, who I work with, Wooditch Court and Yarratara Health. And each archo within their region is looking at climate health adaptation and with a real local lens, which I think is really important. The project comes across 4 phases, and phase 1 is having an understanding of the local impacts of climate change, specifically extreme weather events. So what that meant for us at CAMS is that we just went across the Kimberley wherever we were and had yarns with the local people about what was worrying them as our climate is changing, and specifically, obviously such a large scale project, climate health adaptation, where to start, what the leading priority is. And when we listened, people wanted to start to think and start to plan about heat and heat waves, which is where at CAMS our project is we're starting. And Aboriginal people across the Kimberley have incredible resilience and adaptation to heat. So listening and understanding solutions and adaptation principles and bringing them through the rest of our project was really the foundation. Phase 2 is creating adaptation frameworks and plans. And so at CAMS, we're looking at a heatwave plan for all our clinics. We've got great initiatives and policy in place already for many extreme weather events that occur in the Kimberley. Flooding, we heard about that. The Fitzroy Valley floods this year had an incredible response from local archers, and also cyclones is something that's embedded within our frameworks, but building something for heat waves and how, as a health service, we can provide a response during those times. The third is creating community communication tools. So essentially holding multiple yarning circles, hearing those solutions, and then creating culturally safe, culturally relevant communication initiatives to both raise awareness about climate change and health, but also how to prepare for and cope during heat waves. And the final phase of the project is embedding it. So, it's great to do things once, but working together with AQUA, with Nyaratara Health, and with Moorditch Court to talk about what worked during each of our projects across Western Australia, and making sure that we build something so our work can be replicated throughout the climate health adaptation space.
Okay, we just have a final question for Jessica, who is online. So Jessica, Lowitja Institute have done a lot of work and research on how climate change impacts Aboriginal and Torres Strait Islander health and wellbeing. Can you share with us a little bit about this and just outline how communities are leading solutions and advocacy on the ground?
Yeah, thank you. And I'll just say I'm really grateful to be able to listen to the other panellists. What they've shared has been quite amazing. And to place myself, I'm a non-Indigenous woman working in this space. I'm on Wurundjeri country today, and I'd like to acknowledge that, and my Aboriginal and Torres Strait Islander colleagues as well. I'm grateful to work alongside. So yes, we've been doing a lot of work on research on climate and health. It goes back quite a few years now. In 2020, we partnered with the National Health Leadership Forum and also CAHA to commission a discussion paper on climate change and impacts on Aboriginal and Torres Strait Islander health and wellbeing. And we held a roundtable as well with Aboriginal and Torres Strait Islander experts and Indigenous experts internationally to talk about that topic and discuss the paper. And then that was incorporated into the paper. So that's available on the website. And I encourage everyone to check it out because it's really great. So that was the foundation for the work that we're doing now. It highlighted several issues. So some of those were that Aboriginal and Torres Strait Islander communities, which we've heard today, are experiencing really diverse impacts resulting from climate change. So there can't be one solution or one approach. It really needs to be locally led solutions. Communities know what they need. And there are those common themes as well, but the diversity is really important to consider and keep in mind. The paper also spoke to the importance of the cultural determinants of health, which we've heard a little bit about as well today, those spiritual impacts of, landmarks being moved. That was a great example. And then the third thing that I'll highlight was there was discussion in the paper around the barriers to Aboriginal and Torres Strait Islander leadership in the space. There is a lot of leadership, and I want to make that really, really clear. There are amazing solutions all over the place. Leadership is very strong, but in terms of government being receptive to and creating space for Aboriginal and Torres Strait Islander leadership, what we found in the paper was that government's been pretty poor at doing that. So voices just aren't being heard, which has been a frustration. And we're not just talking about national leadership either and having a seat at the table when it comes to policy making and those bigger decisions. It's also about the lack of support and empowerment for community leadership as well. So what we've been hearing in our work recently as well is that communities, they're taking leadership, they're taking action, but they're not resourced. So that's another issue. So over the last year or so, we've been really continuing the work on that foundation through a lot of community engagement across the country. And we've been really exploring what different communities' priorities are, how climate's impacting on cultural practices, how this connects with health and wellbeing. So taking a very holistic approach and holistic lens. So for example, one of the things that we've been hearing in Tasmania is that there's huge concern about the loss of the kelp forests due to warming seas. And great concern about what that means for cultural practices that are connected with those kelp forests. So traditional necklace making is one of those practices that is going to be impacted. But also old growth forests in the west that are burning that have never burnt in the past. What we've been hearing in WA is, amongst other issues, one of the things is loss of traditional food sources. So that biodiversity impact, loss of wildlife, and how this impacts on totems and cultural practices and connections with country, hunting practices. In New South Wales, what we've been hearing, river communities are concerned with water security and food security as well. So there are lots of cultural practices or the ability to practice culture that come from not being able to fish, or when there's a heat wave and it's too hot to be on country to practice ceremony. And the impacts of mining have come up as well as priorities. And I will say, I agree that there's a lot of doom and gloom, but there's also some real opportunity and optimism as well. So one of the things that we've heard in New South Wales that's happening is Aboriginal community have actually been able to go back on country where mines have closed and start to heal and restore country. And so I think that's a really great example of, like a solution that's connecting back with country and culture and can give us some optimism. Some of the common themes that are coming out of the yarns that we've been having are the importance of Aboriginal and Torres Strait Islander voices, leadership and wisdom, which we've heard from multiple panelists already. The need for workforce development has come up as well, and capability building and funding for that. There's a real interest in peer-to-peer learning around adaptation approaches. So what we've heard from communities is that they'd love opportunity to come together and have a yarn and share knowledge and share what they're doing to kind of build something together. There's that idea that Aboriginal and Torres Strait Islander ways of being, knowing and doing do benefit everyone, which panellists have said. And that real need for recognition of Indigenous knowledges by governments and academia as scientific. So there does seem to be this kind of sharp divide between what's considered scientific and evidence and what's not. And as panelists have said before, Aboriginal and Torres Strait Islander peoples have deep knowledge of country and scientific practices that span millennia. So we need to think about how to encourage the mainstream to acknowledge that and value that. And then also concerns about loss of food sources and natural disasters and impacts on social wellbeing. So the other conversation that we've been having, and I'll get to the end of my response soon, was that there's a real need for government to listen to Aboriginal and Torres Strait Islander peoples. And so generally engagement by government has been pretty poor. Where it happens, it's consultative, it puts the burden on communities who have very stretched resources, not a lot of time. So the will to engage is very much there, but the resources aren't. So the other thing that we've been looking at is the feasibility of establishing something like a coalition, an Aboriginal and Torres Strait Islander coalition on climate and health. And what we're hearing from community is there's quite broad and strong support for something like that, because it would really enhance Aboriginal and Torres Strait Islander leadership in the space and ensure that Aboriginal and Torres Strait Islander priorities are centred and factored in at the national level. And we're also in the process of commissioning another discussion paper as well that's looking at rights-based approaches. And I think I'm at time, so I'll leave it there.
Thank you, Jessica. Now, we are losing Dr. Walley at 10. Before we do lose you, climate change is a symptom of colonial settler mindsets. Decolonising process and practice is required. So the question is, what are your dreams for decolonising government in WA? Just a little question.
Dreams can be nightmares, I suppose. It depends how you interpret them. I firmly believe that common sense is not common anymore. That's a challenge. It's that when you're doing the same things and trying to get a different result, it doesn't make any sense. And if you've got a system that's existing that is not improving anything, then you must challenge that system. And what colonisation done is brought a series of systems from a deficit model. So at the time of colonisation, the basis of the colonising country was not in a strong foundation. And that's historical. It's not me again picking on anyone. That's just the facts. So the facts are, when that date, just pre-contact, 1 year before contact, the life expectancy and the models of operation within the colony foundation of England, we're at a very low base. Everyone knows that. The opposite end, 1 year before contact here, we arguably had the strongest base and lifestyle was at a high level. And this, when you're talking about decolonisation, the decolonisation is just two simple words, ignorance and arrogance. Do not be ignorant to the fact that there are other existing processes that may be superior to yours. Do not be arrogant enough not to have a conversation about them. Simple as that. And unfortunately, if I leave, I'm going to go and leave and take with me all the male representation. and Dr. Souza in space will look after us. But I firmly believe that it's no coincidence that a lot of the conversations now in different areas are led by women. Because it's the same thing in our culture, we had that equality from the start. So what a lot of women are fighting for now, in our culture already existed. And that was imbalanced by colonisation as well. So I believe the simple answer is we as a society have to hold people accountable for their positions and their actions, and not necessarily what gender they are or what race they are, but the position you hold that can make a difference. Where's your quantification? Forget about your qualifications. You're qualified, you can acquire a qualification. Your quantifications, you live and get that experience. That's got to come into the thing. And I'm sorry I got to leave, or maybe some people are not sorry I got to leave, but thanks for me being a part of this panel. And again, we're only doing teasers and touching into greater conversations which are out there. And these teasers are one of those raindrops that may hit a seed that may sprout out. So each raindrop is important, and each of these conversations are important. So never underestimate the power of yourself and your contribution. Thank you.
So I have another question that's come in, and quite a few people are really keen to hear more around this. Someone's said they really love the idea of prescribed nature walks, and this will be a question for our Darwin presenters, I think, and others may have something to add. But how have both patients and clinicians really embraced this concept?
Thanks for the question, to whoever asked that. I think in terms of the Darwin experience, the health workforce, particularly the very stressed medical, nursing, physio staff, they've all been, and because I know them, they've come forward and said things like, I now park in the furthest car park because I know I can have a really wonderful interaction with plants that are flowering at different times. And we've just had a whole amount of red-collared lorikeets, which are related to your rainbow lorikeets down south and out west. And they're creating this incredible bird song, and they're coming for the flowers that are in bloom on the Melaleuca at the moment. It's just absolutely wonderful. And that is exactly what a nature prescription is. It takes you out of your woes. It takes you out of what you're perseverating on to do with your own personal health, or the ward round you've got to get to, and the amount of people you've had on call. And it's low cost, it's zero cost, it gets you moving, and it gets you out in the fresh air. It's just a wonderful example of high value, low cost healthcare, which is a great way to decarbonize. And if we repeat that over and over again, not just while we're at work, but on the way to work and on our days off, it's wonderful for patients to and the workforce to defrag. Aunty?
And from a very old spiritual healer point of view, when you get into on Mother Earth and with Mother Nature, and you can see, smell, feel, hear all of those beautiful things around you, it is nourishment for your soul. And when your soul is really nourished, your spirit rises, and then you're able to go and, I don't know, you just think better, you physically feel better. And you're, yeah, I can't advocate enough for doing what we're doing in Darwin. Thank you.
Thank you. Terrific. Now we're running low on time. We've got lots of fantastic questions. I think we've probably only got time for one more. So I'll ask this question and perhaps start with Carol, and then Dr. Carlson, you may have something to add. So the question is, how can we make primary health centres culturally safe and meaningful for First Nations peoples? We've heard about Royal Darwin Hospital doing that through greening and embracing nature, traditional plants. So from your perspectives.
I think there's a lot of information out there where this is, I mean, I think the health sector is leading away in many parts, if you think about the panelists and the conversations we've heard today. But I think what we talk about with Danjoo Koorliny is there's a need for da ni, which in Noongar interprets as deep listening. And sometimes people think that they've heard the meaning, but they're not interpreting the meaning the way in which we express. So I think there's a lot of consultation, a lot of time spent into a lot of consultation, a lot of research, but I think we need to be doing a lot more collaboration and see what are the best practice, because there are best practice. When you think about what Darwin's doing, how much more of this stuff can be shared across the country so that people start seeing the best practice of those great projects, processes that are working, because we need our people inside of those institutions to ensure, like I said, chronic health in our people is rising in the nation, and our people become the patients in these institutions. So I think what we need to look at for this whole process is a strong affirmation of action for change. You know, we can put all the tags across all the different tag words that we do all the time. Every year we know we get a new buzz of something that we've got to focus on. I don't need to tell you that, it happens across every sector. But well-being is well-being. Health, chronic health is chronic health. And we need to lift that in a better way. If you think about our state is leading, I was at the Perth Children's Foundation breakfast, and I think, you know, they talk about we are leading the world in some of our research here in Western Australia. The world, we are leading in the world. So if we can do that, surely we can make a shift for change in what we're doing now.
Dr. Carlson, would you like to share some thoughts around that?
Oh, thank you for the question. Deep listening, definitely. And for me, if I can kind of close on some research that I've done across 5 hospitals in Auckland, and it was around a Māori service that are placed in 5 different hospitals, and these are Māori workers that are there to support the health system and our Māori people that come into the hospitals. And what I was brought in as an evaluator was to design a model of care that emanated the work that they did. And it really started with a wonderful word, and I'm not swearing, it's called whakawhanaungatanga. And whakawhanaungatanga is really around relationships. And so firstly, relationships are around you. So it's on your thumb. You're the most important part of the health system, whether you're a doctor, a patient, a support worker, a groundsman, you are the most important part of change. And as a thumb, you're malleable and changeable, and you can grip onto action and move with it. So your thumb is a very important part. So you are at the center. Then your forefinger, which is your family, they determine how you grow and give you the boundaries and the determinations for what you do. So your family are very important in the process. Then we've got the middle finger, which is the highest point on your finger. And those are your leaders, your advocates, but also it's a point for social justice and change. And it's about giving the finger to colonial power. And let's get real, sometimes it takes a bit of this work. Then you've got the work of this finger here, and it's around, let's all place our hands on a surface and try and lift that ring finger up. It's really, really hard to do without all the rest of the fingers. So it's a point of making sure that our actions are also in alignment with every other part of our relationships with the world. And then the smallest part is to remember ourselves. So we are the children of the earth, and to pinky promise to always look after Mother Earth, because she will determine every point of abundance for our people. So I just want to leave with that and hope you never look at your hand ever again the same, and you give your hand with an open offering of love and acceptance and compassion. So all those people that come into your life can come in and disengage when they like, rather than this model of grabbing on and pulling you into different ways. So it's very much offered with love, aroha. Thank you.
Thank you so much. We've heard a little bit about greening hospital campus. This is quite a popular question, so we'll ask this one. Someone would love to green their hospital campus, but they said it's a bit of a concrete jungle. Doesn't sound at all familiar for any hospital campus I've ever been on, but anyway. So any ideas how to do this without being able to put plants into the ground? And I'll open to any of the panelists, because there's been obviously research, but also Darwin has done a lot of work in this area. But if anyone else.
Yeah, I really love the analogy of the hand. So thank you so much for that, Teah. So I think, there are really simple things like pot plants. There's been a lot of work done in the water sensitive city space about green walls and what that will mean. And we've done some that is specific to the West Australian climate, because obviously you can't have them facing west. And so that also will obviously include bringing everyone with you. So you'll need your facilities management on board. So it is a kind of shared endeavour, definitely. But you can find spaces anywhere. Indoors as well is really helpful. And just even, we saw that Darwin, that photo, that was a concrete jungle, and yet they still managed to make that space into something beautiful. So it might take a bobcat to maybe rip up some concrete, but if you're committed, then I think there are definitely opportunities for it as well.
We can chip in briefly. I agree with the sentiment, anywhere can. All the literature on green spaces in biophilic design in healthcare is using, working in with your workforce, looking at patient journeys and staff journeys to make sure that people who are time poor and who are traveling on certain routes have the most chance to have even a 5-minute repeated encounter. And that can look like a little courtyard garden. It can look like a rooftop. It can look like just the entrance where the ICU staff come out and scoff their lunch. So that's, everything and anything's on board, and just important to get the balance right between guerrilla gardening and permissions, and doing your due diligence with underground services, for example.
Great, thank you. We might wrap up there. Apologies to those of you that have put questions through that we haven't had time to get to. Hopefully some of the responses will address some of those questions, but I think the level of engagement is reflection of the quality of the presentations, but also the information that's come through this panel. So I'd just like us all to put a final hand of applause together for our panelists.